successful company is greater than the sum of its employees, and much more so when those employees are healthy and connected with the company culture. I'm Adam Salati, and today I'm speaking with Shana Ananjawala and Kunal Chopra, who have been working to coordinate employee health with company goals through Healow at Work. Thanks for being here today.
Thank you for having us.
So people may or may not be familiar with Healow to begin with, and much less Healow at Work. What's Healow's mission, and how does Healow at Work expand on that?
Healow's mission is to help providers better engage their patients by providing them access to the health record, ability to book appointments online, and to share their health and wellness data. Healow at Work expands on that by allowing employers to do the same thing with their employees.
So where did this idea come from? What was the generation? Why did we decide that this was important?
I actually work on our wellness team here at eClinicalWorks, and what we found a couple years ago was that we needed a better way to inform all our employees about challenges and events that we were having. And also we saw that our healthcare costs were rising, so we wanted a better tool to manage both of those. And in 2014, we went live with about 1,200 of our employees at our Westboro location. And then since then, we've gone live across the country with all of our other locations as well.
So what are some of these activities and events, these wellness events that you've organized through Healow at Work?
Healow at Work allows you to run challenges and events. Challenges essentially allow employees to compete against one another in things like who can walk the most steps, who can walk the most distance. Events are essentially company events that you can run and track to see employee participation. We also allow employees to share their wearable device data. So if we have a Fitbit or with things, a Jawbone, you can link that to Healow at Work, and we can actually grab the data of the device and allow you to compete in challenges using that data. We also provide access to cost transparency tools. So if you want to look up prices for prescriptions, you'll be able to do that as well through Healow at Work. And these are all the things we're doing today with our own employees at eClinicalWorks.
Okay, what about some fun activities and things like that?
Some of the activities that we do today, a lot of times we do step challenges. So all the employees that have some sort of wearable step tracking device, they hook those on and we do step challenges in that way. We also do all of our events on Healow at Work. So if we have a yoga series or some sort of Zumba class, we put all of those in Healow at Work, and then the registration happens that way.
I've noticed that around holiday time, we see announcements for pumpkin painting and gingerbread houses, and those types of things also fall into Healow at Work.
That's
as well, right? You see a lot of engagement with those activities?
Absolutely. That's how we get most of our employees on Healow at Work, actually.
Certainly, making it fun for everybody. So tell me about the employee experience on Healow. I know I can be invited to some of these events, and I can participate in them. I can share some of my data, but what does the employee see, or how do they navigate through Healow at Work?
I would say, like I said, most of our common things that people actually go on Healow at Work for are the challenges and the events. The employees have the ability to create teams when we do some sort of step challenge like that. They can create a team, they can name their team, they can upload a picture, and that really engages them to do that. Also, when they sign up for their events, they can see who's already signed up. There's a whole participation list, so they might see, oh yeah, this person's also doing, I want to compete against them, or I want to join them, or I don't, but hopefully they do. And then they can also add a picture or comment or those types of things on the events as well. We can also do link to their personal health record. So if they see a provider that is on eClinicalWorks and they've enabled them for Patient Portal, they can see their health record on Healow at Work.
So we're trying to tap into that competitive spirit there with the employee engagement, but also give them additional tools to bring in some of the information that they might be searching for in other places like their patient portal. If I'm an employer that's using Healow at Work for my employees, I can invite my employees to those events, and hopefully they get the fire lit under them and they want to participate. But why wouldn't I just send out an email blast to do the same thing?
I think doing it through emails is the most common method today. The drawback there is that now you're receiving email replies from every employee that wants to participate, which can be really hard to track. What we do is through the events in Healow at Work, we allow employees to track these participants online, see a running list of employees that have signed up. They can send messages to these employees, let them know of any updates. Employees can share comments with one another. Think of it like a social platform almost. It's a work site with a little bit of social experience behind it. Employees can also do things such as share pictures about the event. So if you have pictures you took during the event, you can also upload those online on the events page.
Does the employee get anything else out of this besides just knowing what events are happening and being able to sign up for them?
I think the social aspect is good for it as well, so that they can become active with one another. I think we see a lot of that in groups. People do better.
Kunal, you mentioned that prescription prices were available through Healow at work. As someone with an employer-sponsored health plan, or really any health plan for that matter, what difference does it make to me whether I fill my prescriptions at CVS or Walmart or Target?
It's a good question, Adam. There's always a cost beyond the copay. So most of us that are on an employer-sponsored health plan don't usually see any cost beyond our regular $20, $25 copay, depending on your plan. But the thing though is that if a prescription costs $40 at one pharmacy and $80 in another, even though your copay is the same, the employee winds up spending an extra $40 filling that same prescription. With Healow Work, we give the employee a tool to allow them to search for cash prices for drugs and to see which pharmacies might carry that same drug for a lower cost. Therefore, encouraging them to go to these pharmacies that are on the lower tier of the cost structure. This saves the company money, which then gets reinvested back into the employee. So it's a win-win situation. The employee is saving the company money, and the employer in turn is investing the money back into the employees.
So as an employer, I might do everything I can to communicate to these patients, or these employees rather, sorry, that this is good for the company, this is good for you, you can save money, you can have this type of an impact. But Healow allows me to actually, as the employee, see the difference there, and maybe that has more of a resonance.
Yes, and in addition to what I mentioned, it also can save you money too. I also want to mention that there are drugs which could possibly fall below your copay amount. So if there's a drug available for $15 and your copay is $20, you save $5 yourself. Now, there are pharmacies that usually tend to carry the same prescription for high prices. So Healow Work, again, arms you with the information to allow you to make these decisions, better decision in terms of saving yourself money and the company money.
Sometimes, in the news we hear stories of people who want less regulation, less oversight from outside groups and entities. And I can kind of see this maybe playing into it with an employer encouraging employees to take a certain course of action. Do you think that employers have a role to play in employee health, and what might that role be?
I think they do. We spend so much time at work, at least 40 hours at work every week. And so I think that it does play an important role during that time to be able to motivate employees to become active. And in that environment of helping each other stay active, I think is also important.
Tell me about some of the tools that are built into Healow at work for an employer who's looking to encourage their workers to make some different health choices.
We also allow employees to access education materials in the form of articles and videos. Think of it like a WebMD that's plugged right into Healow at Work. They can look up information about diabetes, obesity, any chronic condition that they're interested to learn more about. We also allow employers to run wellness programs to target chronic conditions. If they have a large diabetic population or obese population, they can create wellness programs to target these groups and help them run through activities or participate in events or challenges to better improve their health. Lastly, I think this is one of the most important things, is the ability to create incentive programs to incentivize your employees to do certain things. You can create an incentive program which requires employees to do certain things in a time period, such as a calendar year. That can include participating in a challenge, in an event, linking a wearable device, exercising. And as they go through and complete these activities, they'll be rewarded, and they can use these rewards to perhaps encash in for prizes that the employer might offer.
What would some of those incentives look like? Like, what are we talking about? How are we rewarding people?
We've seen other employers give cash incentives. Some people give a day off for incentive, premium reduction as an incentive. Those are probably the top three that we've seen. But you could also do material things like a wearable device or a t-shirt, anything like that.
So how would I know which of my employees deserve this incentive?
So we have reports at the end of the incentive period where you would be able to run the report and see who qualifies for that particular incentive that you've set up at the beginning of the year.
Okay, so I'm guessing the people who participate in the most activities or maybe make the most steps are going to be high on that?
Yeah, it depends how you set up the incentive at the beginning of the year. If you want to give points for taking the health risk assessment, for competing in one of maybe 10 challenges, for competing in a wellness programs, depending on how you set that up at the beginning of the year, you can vary how you want to give out your incentives.
What are some of the other features of Healow at Work that we might not have discussed yet?
We also have reports that we haven't really touched on yet. So we have participation reports. So as an employer, I could run those to see what the most participation is in a challenge or an event. So I could run future events of those kinds so that obviously people like them. We also have an aggregate health risk assessment report. So the employer, again, just like Kunal was talking about that personal report that the employee gets after they take the health risk assessment, the employer can actually get an aggregate report so they can see their population, what the healthy areas are and what the risky areas are.
And of course, we're talking about de-identified data.
That's right.
At this level, the employer doesn't know which
Correct.
people have responded to which items. So based on your experience so far, I mean, it sounds like we have a lot of things that are available for the employees, for the employers. Who's most interested in Healow at Work at this point?
From our perspective, we feel that any employer that's interested in the health and well-being of their employees should be interested in Healow at Work. But in addition, we feel that health service providers that provide health services to other employers would most particularly be interested in Healow at Work, since it provides them a platform to deliver health and wellness tools and offerings to their employer clients.
It sounds like that's even another level above what we've already been discussing with Healow at Work. How would some sort of a health service provider manage something like that?
It's common for health service providers to set up on-site clinics on their client sites. This clinic traditionally offers health services in the form of acute condition care. You know, if you're suffering from cold or cough or a flu, these are acute conditions that you can go into that on-site clinic and be seen by the nurse practitioner that's staffing that clinic or the physician's assistant. The Healow Work tool allows you to engage the client's employee population as a whole and not just for individual events such as these acute conditions. You can motivate them to exercise, eat better, to take better care of themselves. So we're looking at this from a perspective of an entire population versus just each event for any patient that might be suffering from an acute condition.
People who are interested in Healow at Work will be wondering is, how do I know that some of these things are working? What do you look for?
We feel that as long as the employees are engaged and we can get them to maybe move a little bit more, eat a little bit better, and are feeling good about themselves, that in itself is a huge bonus to Healow at Work.
If you're an employer looking to improve the health of your employees, there are a lot of tools in the market that offer you the ability to do things like run challenges using wearable device data, or to run wellness programs, or to allow your employees to complete HRAs. While these tools do exist, there aren't any tools that allow you to do all of these things at once. And that's why Healow at Work offers a complete package to allow you to run challenges, to run events, to complete HRAs, to run wellness programs, incentive programs, and provide cost transparency tools on top of that.
So if I want to learn more about what Healow has to offer, and it does sound like it's a lot, where would I go?
You can go on Healow.com and click on the Are You an Employer button.
Well, we certainly hope to see more out of Healow at Work in the future. And you can also find our podcasts on my.eclinicalworks.com, as well as on YouTube and for download on iTunes. Shayna, Kunal, thank you so much for being here today.
Thank you for having us.
You're welcome.
For the eClinical Works podcast, I'm Adam Salati.
This broadcast and its contents are the sole property of eClinical Works and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinical Works Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinical Works Public Relations with any questions. eClinical Works V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinical Works V10 CC 2014 955447-1.